Om Swastiastu. Greetings to facilitator and evaluator. We are from small group discussion B3, and in this opportunity, we will present our student project with title Electroconvulsive Therapy or ECT in Psychiatric Medication. Next. Okay, and these are our group members that participated in the student project presentation. My name is Ananda Raharja with number 136.
My name is Dewa Prema Shanti and my number 004.
And my name is Adelia Febrianti Puspa Dewi. And the last 3 digits of my student ID number is 041.
My name is Angelique Cynthia Caroline, and the last 3 digits of my student ID number is 068.
My name is Anggi Triana Devy with last 3 digits of student ID number are 088.
My name is Putri Yudhistira Kawardana and my last 3 digit student ID number is 098.
My name is Bagus Satia Bayu Saputra, and the last 3 digit number of my student ID is 104.
My name is Felix Stefania Robertson Lubis with number 113.
My name is Trifena Lisanias with last 3 digits of my student number is 119.
My name is Sophie Paramita and my last 3 digit ID number is 156.
My name is Evangelina Vincent Utamila Serda with 3 last digit student ID number 170.
And my name is Gusti Ngurah Tata Adityawarnam with the last 3 digits of student number 215.
Okay, on this occasion, I will explain about chapter 1 introduction. Next. So, psychiatric disorder are one of the problems that often occur in the world, and the prevalence continue to increase globally. Based on the research, the prevalence of people with psychiatric disorder is about 264 million with depressive disorder, 45 million people for bipolar disorder, 50 million people have dementia, and schizophrenia disorder that has affected about 20 million people in the worldwide. Therefore, psychiatric disorder should not be underestimated. In overcoming psychiatric disorder, there are various ways to overcome it. One example is ECT. Well, for the next point in chapter, will be explained further by my friend. Thank you.
I will continue the presentation. ECT or Electroconvulsive Therapy is a treatment method that stimulates brain tissue using a controlled electrical current, which causes generalized seizure. It was first done in Italy, 1938. ECT is one of the most effective treatments to treat patients with psychiatric disorders. Usually, it is used to treat patients with severe major depression that doesn't respond to drug therapy or in a situation where using pharmacotherapy is risky. Several studies said that this form of treatment is the most effective and the least risky one among others intervention that perform under general anesthesia. However, some studies said the opposite things about this treatment, which is they said that this therapy could cause brain damage. Therefore, further explanation is needed to discuss about ECT as a therapy. Next.
Okay, my name is Bayu, and I will continue the presentation with chapter 2, discussion. Next, I will explain the mechanism of action and the limitation of ECT. Now, the mechanism of action of ECT is still poorly understood because ECT works by triggering generalized seizures. So the biological change cannot be attributed with a singular mechanism of action. And the limitation of ECT is usually because the stigma revolving ECT. Because ECT remains stigmatized because of the lack of knowledge and understanding about modern ECT technique. And because of that, ECT is usually reserved for life-threatening incident, even though it can help with non-life-threatening incident. Next.
Okay, 2.2, the effectiveness of ECT in therapy. A limited number of studies have examined the effectiveness of ECT in schizophrenia. Based on a study conducted in 10 homes, it is reported that there was at least one ECT treatment against the will of the patient during a 12-month period out of total of 15 identified cases. The low response makes it difficult to estimate the actual number of cases. Although the limitation of the study, retrospective study design, and low response led to an underestimation of case number. It seems highly unlikely that this last difference was simply due to methodological difference. Next.
Okay, my name is Ananda, and I will continue the indication of ECT. The primary indication of using ECT is in patients with severe major depression that interferes daily activities or even resistant to treatment. There are suggestions for using ECT in patients with other psychiatric disorder, such as bipolar disorder, manic episode patient, acute and chronic treatment-resistant schizophrenia, catatonia, schizoaffective disorder, and life-threatening symptoms, example, suicidal behavior, severe psychosis, and food refusal due to depression. Okay, that's all about the indication. The contraindication will be continued by my friend. Thank you.
My name is Adel, and I'll continue with the contraindication. Initially, ECT has no absolute contraindications. However, based on the literature by Salik and Mawaha in 2021, a pheochromocytoma and elevated intracranial pressure with mass effects are absolute contraindication to ECT. ECT can cause side effects in some individuals, especially patients with cardiovascular, pulmonary, or central nervous system compromise. Relative contraindications of ECT includes elevated intracranial pressure with a mass effect and space-occupying lesions in the brain, recent cerebral hemorrhage or stroke, bleeding or otherwise unstable vascular aneurysm, and all associated conditions that may increase the risk of complications from general anesthesia and the induction of seizure activity. Next up.
Okay, my name is Dewa Fony, and I would like to explain about ECT adverse effects. The first is general adverse effects. Some of the general adverse reactions that patients may complain about are nausea, headache, and dry mouth. Those adverse reactions usually only temporary and not too severe. Dry mouth adverse reaction may occur due to anticholinergic drugs that given pre-medication. The other adverse reactions, such as nausea, may occur due to the other side effects such as headache, although it also may occur due to anesthesia. This headache usually mild and self-limiting, and those are the hallmark of post-ECT headache that commonly found by 26% to 85% patient of ECT.
Okay, my name is Yudhistira, and I will continue the presentation. So the literature show that cardiac adverse effects are the most common cause of post-ECT mortality and morbidity. But the rates now have been decreased because we have improved techniques such as blood pressure and then continuous cardiac and ECG monitoring and also anesthetic technique. There is also higher chance for patients who have pre-existing heart disease than who don't have. Then the cardiac adverse effect that can be experienced by the patient are like asystole, increased blood pressure, electrocardiogram abnormalities, and myocardial infarction, and also cardiomyopathy. Next.
Thank you for the opportunity. Now I will continue with the neurologic adverse effect. The most common neurologic adverse effect is memory loss and may occur at least 1 in 3 people. The patients may lose their memory about the events before and after ECT. Fortunately, most studies show that memory loss is usually temporary. Other than that, several studies show that during ECT treatment, there's an increase in the cerebral blood flow. This may occur as a result of increased oxygen demand during the ECT treatment, where it may cause functional damage to the blood-brain barrier. These changes can increase intracranial elevations and sometimes cause transient benign brain edema. However, the percentage of these complications is increased in patients with pre-existing central nervous system lesions. That is all for ECT adverse effect. Next will be delivered by my friends. Thank you.
Yeah, thank you for the chance, Sophie. Now I will continue the presentation. As my friend already mentioned, the ECT is causing seizures. Patients are often injured due to these seizures in the first few years of using the ECT. Anesthesia agents started to be performed in ECT in the early 1950s, and it had been shown to reduce the injury. Thus, nowadays, ECT is much safer and well tolerated with anesthesia agents. But sometimes, the using of anesthesia becomes difficult in patients with coexisting diseases. Therefore, in order to provide the safe application of the procedure, the members of healthcare team need to consider the patient's current medical status and how it may affect the treatment of ECT. That's from me. The presentation will be continued by me. Thank you.
Okay, I will continue the presentation with the last part, which is the conclusion. Next. For the conclusion, electroconvulsive therapy is one of the existing and the most effective treatment for psychiatric disorder, such as major depressive disorder or MDD, or severe depression, schizophrenia, bipolar, and etc., and has been used for over 80 years. In the majority of the cases, clinical improvement occurs as early as after 4 or fewer treatments. Okay, for the next part, will be continued by my friend.
I will continue the conclusion. The main indication for ECT is severe major depression. On contrary, ECT can cause side effects in some individuals, especially patients with cardiovascular, pulmonary, or central nervous system compromise. ECT was performed without anesthesia in the first few years and began to be used in the early 1950s, and it is safer nowadays. Next. And here are our references. And that brings us to the end of our student project presentation, and we would like to apologize if there are any mistakes during our presentation, and we would like to thank you for your time and attention. Thank you.